Excellent. So once again, this is the UC Berkeley Online Masters in Public Health program, talking about how to select your concentration. My name is Elise Rudolph. I am the Director of Online Admissions and Recruitment. I use she, her pronouns, and I'm joined by my wonderful colleague, Stephanie. Would you like to introduce yourself?
Yes, thank you so much for the introduction. My name again is Stephanie Nguyen. My pronouns are she, her, and as the online education recruitment manager, I support students with learning more about the program. And also, if you schedule appointments with me, I can also walk you through the admissions process and really, um, discuss any questions that you may have around that. So together, we make the admissions team, and we work to ensuring that you feel confident in your decision as you explore graduate programs. So, thank you again for joining us.
Awesome. So today, Stephanie and I are going to talk a little bit about what public health is. We realize some of you might be in different stages of the graduate school research process. We'll talk about the basics of what public health is, why it matters to earn a master's degree in public health specifically, what benefits that has. And then we'll dive into the various concentrations that we offer, as well as, like where, depending on which concentration you do, where do our students end up? What sort of careers are they taking on? What do their salary prospects look like? Things like that. And then we'll talk about what makes us unique at UC Berkeley, and we'll have time for Q&A before we close out. And with that, I'll hand it over to Stephanie to get started with some background on what public health is.
So, as some of you may know and have an idea of public health, it is a broad space, but to others, it might be a completely new field. And essentially, the study of public health promotes and protects the health of populations through evidence-based research, education, policy, and community-based prevention. Public health is a highly accessible and broad field open to individuals from diverse and academic and professional backgrounds who are united by a commitment to improving community health. So with this in mind, we do offer 4 concentrations, and they are designed with flexibility to support your goals. So essentially, this is a field for students that may have already been in and exposed to the field of public health, or maybe learning about it for the first time. A lot of folks make pivot in. So why earn a Master of Public Health, or what I would say an MPH for short? Earning an MPH at UC Berkeley's School of Public Health is not just about gaining knowledge, but essentially you are building practical skills in data analysis, program design, and policy evaluation that really allow you to drive measurable improvements in community health. This training prepares you to prevent diseases, shape evidence-based policies, and address complex public health challenges across diverse populations. So really, this isn't just a degree that you've earned, but it's a pathway to creating healthier communities, shaping policy, as I mentioned, and really making a lasting impact in the world. So this, I would say, in short, is not just individual based, but it's really to support communities at a population level. So we're really working on prevention and creating healthy spaces for all.
So we want to give you a bit of an overview of where our students end up. I'll also add that, a number of students in our program, they might already be working in one of the fields or companies that you see listed on this slide. And they're getting their MPH because they're looking for some sort of career growth. They want to move into a different department or division within their company. They're looking for that promotion. And then we also have students who are looking to pivot, as Stephanie mentioned, into the field of public health, or maybe from one job sector into a different job sector. So, if any of those options resonate with you, know that we have students definitely in that position. We've had folks who are totally career changing. We've had folks who are like coming from journalism and shifting into public health, or maybe they're moving from law into public health. So that's totally normal. And then it's also totally normal if you're already, for instance, working at a healthcare company and you want to layer on the public health education to improve your workability or increase what you can do in your role. So we have students who either come from or go into academics. So they might become faculty members or researchers at an educational institution. You can see some of the places that we have students and alumni working. We definitely get a lot of folks who are working in the public sector, so maybe in a community health organization. It might be an NGO of some sort. It might be working as a quality assurance manager. We definitely get a number of students from healthcare, so it might be clinicians like MDs or nurses, dentists. That's a common one. Or working in hospital administration even. Data analytics and research. So we will get into this, but we of course offer an epidemiology track. And so we do have plenty of students who become epidemiologists after completing this degree. They might be data scientists or working at a biotech company as a biostatistician, all sorts of roles in that space. And yeah, we have folks who have come from or gone into legal settings as well. So it might be environmental health safety, things like that, risk management, any of those areas. And you can see some of the companies where we have students, places like UCSF are common. Kaiser is very common, Genentech's very common. Of course, the California Department of Public Health is common. We have folks doing consulting with Deloitte, all sorts of different areas where our students end up working. All right. And so we're going to dive in now into the different areas that our students can concentrate in. One thing I like to share up front is that what's great about our program is your first year in the program is your core and breadth courses. So every student in our program is going to take the same 6 core and breadth courses during their first year in the program. And then it's really in your second year that you start taking these concentration specific classes. So again, your first year is very much your core public health generalist coursework. We want to make sure everyone leaves the program with that strong generalist education. And then your second year is where you specialize. And we offer 4 ways that you can specialize. So the first is interdisciplinary, which might sound a little contradictory. Like, how do you specialize in an interdisciplinary option? But interdisciplinary really means it's like a build your own pathway. So it gives you the freedom to select courses from a variety of different areas and build a pathway that fits your specific career goals. So if you're looking at these other 3 concentration options on the screen, health policy and management, food, nutrition, population health, or epidemiology and biostatistics, if those 3 don't really resonate with you, like that's totally okay. Interdisciplinary might be a perfect fit then. Within interdisciplinary, you can select from a variety of different tracks. So you can do a community health sciences track, you can do a global health track, you can do spatial data science as a track. We also have students who will take electives within the other concentrations. So maybe taking an elective that's from health policy and management, or a food nutrition population health elective, or an epidemiology elective. So you can definitely pick and choose classes that best suit your career goals and the skill set that you want to gain from this program when you choose interdisciplinary. One other thing that's great is that regardless of which concentration you choose, we also offer a few certificates. The only one we're offering at the moment is the Health Policy Management Certificate, but you have the ability to layer that certificate on to any of these concentrations. And that's how I'm going to segue into the second concentration we offer, which is health policy and management. So this, of course, we'll dive into the details, but one thing to note is that if you select this track, or this concentration rather, you automatically earn the health management certificate as well. And that is something that shows up on your diploma and your transcript. So it's a nice additional feather in your cap that you'll automatically receive if you go the health policy and management route. The third concentration that we offer is food, nutrition, and population health. And then the last option is epidemiology and biostatistics. And we'll go ahead and we'll dive in a little bit deeper into each of these. So for interdisciplinary, as I mentioned, this really is about, forming a program or designing a program that aligns with your specific goals and skills. So we say that interdisciplinary is focused on understanding complex issues and the leadership challenges of successful interventions in public health using a multidisciplinary approach. So we really think that, depending what sort of sector that you're working in or what sort of public health interventions you expect to work on, having the this multidisciplinary approach that you get through an interdisciplinary education can be really effective. Skills that interdisciplinary students gain is multi-level systems thinking, cross-sectoral leadership and communication, evidence-based design and evaluation, community-centered advocacy. And there are a number of different career fields that these students go into. So one thing, again, that's nice about interdisciplinary is it really can be applied to pretty much any sector of public health, any sort of industry within public health. So we have folks who've done interdisciplinary and they end up in health tech, research, government, again, nonprofit or NGOs. And so it just gives you a really strong way to approach complex problems. And again, you can kind of choose classes that align with the skill set you specifically hope to gain. All right, and we'll talk a little bit now about health policy and management. So, health policy and management is really about developing high impact leaders and practitioners in management, health policy, and research roles through skill-based learning and systems level pedagogical approach. So, yes, I think the title of health policy and management really says a lot. It's often folks who want to go into healthcare administration. They might want to do policy or advocacy work or research work that's related to policy and advocacy, things like that. So the coursework that you'll take in this concentration includes some management courses. So things like that would teach strategic leadership, diffusion of innovation inclusion, decision making. You will learn finance and economics, which is very important. You'll take healthcare finance as a part of this concentration. You have the opportunity to take policy coursework and again, economics coursework. So understanding economic efficiency, policies that advance equity and incentive structures. All of these are super important. The way I've heard faculty describe this concentration is they're essentially teaching you how to make really good decisions or make really make good choices when you have hard decisions. So they really help you, analyze what information you have access to, identify what information you need, understanding economic systems and things like that to ultimately make strong decisions. So this is great for folks who, again, want to maybe go into healthcare systems. They want to influence policy decisions. Maybe you're a person who has to tackle very complex problems within your role. Or you're someone who's moving into a leadership role. This could be a really great option for you. And now I'll hand it over to Stephanie to talk a little bit about epidemiology and biostatistics.
Thank you so much. So the epidemiology and biostatistics program really focuses on understanding the patterns, causes, and distribution of disease in populations. So in this program, you'll be using data, statistical modeling, and a lot of quantitative methods to inform public health decisions. And it also emphasizes designing and evaluating effective strategies for disease prevention and control. And some of the outcomes that students will gain in this concentration are learning how to use statistical analysis, And some of these systems might be with R, SAS, and so forth. And the nice thing about epidemiology and biostatistics is the flexibility of how you're applying these tools. For example, you can learn more about disease surveillance and outbreak investigation, what questions to ask. You can learn how to use that data to forecast as well, data interpretation and evidence-based decision making. So public health has a lot of focus on how to make good decisions and how to do it effectively. And of course, communicating the details that aren't really easy to read, right? You're really breaking it down and making it accessible to all. So you're communicating quantitative research and translating it into policies and programs and really making it easy for us to understand. Us meaning populations, folks that you're collaborating with, decision makers, and so forth. So really all aspects. Some of the core classes that you would also take is epidemiologic methods. Another course is the intermediate biostatistics for public health, implementation science, applied cases, and data visualization for public health. One thing I should also emphasize in our program is while you're taking your concentration courses, you also have electives. So keep in mind that everything that we are mentioning to you, there would be an opportunity to also use these courses as electives as well if it's not your primary concentration. So it's a really, really flexible program. Some of the spaces that our students, or not just our students, but in general, folks with a public health degree may go in is, for example, public sector, healthcare systems, research and academia, pharmaceutical and biotech, and so forth. So you can see quite a lot of overlap in many of the spaces, and it's really interesting to see how these degrees can be used. For example, I like to always share epidemiology and biostatistics may not only be in, regular research hubs. I have seen students apply this in the NBA, if you're familiar with basketball, looking at player safety, for example, versus a more traditional path where they may be at CDPH, looking at outbreak investigations. So you really can apply this in so many different ways, which I really, really love. And if you're interested in any of these areas of uncovering or for example, understanding why diseases spread and how to stop them. Maybe you like to uncover patterns. Maybe you like to ask questions and really drive into what that means. Looking at how to use numbers and research so you can help influence real world decisions that will really impact our population health. And also, of course, investigating. If you really like to investigate and really analyze, this might be something to look into. And food nutrition and population health is one of our more formal and recent concentrations that we have brought into our program. We always had it housed under interdisciplinary, but now have formalized it into its own standing concentration. So it's always been there, but now it's just its own thing. The food nutrition and population health program essentially aims to achieve health equity through food security by designing, evaluating, and implementing population health nutrition interventions and policy reform. So this is really great for somebody who really wants to unpack the layers of how things come from policy and lands on your dining table or wherever you choose to eat, right? Like really thinking about ways to make food accessible, food healthy, but also looking at this from a strategic standpoint. And some of the concepts that you and skills that you will gain in the space here are around policy and evidence-based advocacy, linking agriculture, environment, and supply chains to policy, really making sure that it's for the betterment of the people. Strategic health communication, really translating complex data into actionable diet and health messaging. For example, if we look at a box of food and we see all these crazy words that we've never seen before, really making it accessible and digestible for the consumer to be able to understand and really know what they're putting in their bodies and making that active choice. The thing I like about public health is we're not telling you what to do, but we're helping you understand what things mean so you can make informed decisions for yourself and surrounding things that you care about. Planning and evaluation, really building the logistical roadmap for nutrition initiatives. So you're working very collaboratively in this space and really making sure that all voices are heard, but that it is something that can be defined and really taking it to that next level in formal steps. Community and design. So if you're interested in creating long-lasting, local, and culturally relevant programs, these are some of the outcomes that you'll gain in the program as well. So very unique classes. One thing I love about this concentration is your faculty mentor or advisor, I should say. The lead faculty advisor has created the whole curriculum, very detailed, and you really get that hands-on training from your faculty lead and just a great amount of unique courses that you can apply to. So some of the core courses that you would take is nutrition assessment. There's food and nutrition and policies and program courses. You can take one human nutrition course, and there's a couple options within that area there. There's two courses that you can also consider, which is the nutrition and community health sciences and global health. And then you can explore some of the electives as well, which we'll be sending out the slides for you. Um, as mentioned, a lot of the roles, can start from local to state health departments. We see folks in federal public health agencies, community organizations, research and education, and so forth. If you're interested in shaping policy, really thinking about nutritional science and how that can move into a more legislative action for food equity. This can really be a great concentration to consider, uncovering root causes of health disparities to build culturally responsive community solutions, really looking into that from a deeper lens and really breaking down all the biases and making more effective or providing more effective support that is more culturally responsive. Translating research into real world impact. One of the things I also love about our program is despite it being an online program, a lot of it is applied coursework into real world impact. So it's real time. You're learning as you go. You're applying the things that you know and sharpening those skills. And it's a really great space to be in. Understanding the broader forces that influence what people eat. As I mentioned, we do not want to tell you what to do, but we want to enlighten you with all the evidence-based research that we continue to uncover and help folks make conscious decisions of what works best for them. And again, living healthy, equitable lives. So with that said, I will pass this back to Elise.
Thanks, Stephanie. So, we want to wrap things up by talking about why Berkeley, what makes us unique. We understand that there are a lot of online masters in public health programs, but we like to think that we are a very special program and learning community. So the first thing here is that we have a diverse, rigorous, and stimulating academic program. Um, UC Berkeley is once again been named the #1 public school in the country. So we certainly have a reputation for high quality academic programs, and the online MPH is no exception to that. This is a true UC Berkeley program. It was started, gosh, I think we're coming up on 15 years ago now. So this was not like an online program that cropped up during the pandemic. This has been a very much values aligned uh, goal of our school to offer our high quality master's in public health curriculum in an online modality. And that's because we truly believe that you shouldn't necessarily have to relocate to the Bay Area to get this high quality education. We also think that there's value in the fact that you can keep working full time while you're completing your degree. We think that adds a richness to the classroom. We like that you're able to apply what you're learning in real time in your work, and that you're able to remain part of the communities that you already connect with. So, this is very much a UC Berkeley program through and through. The staff who work on this program are UC Berkeley staff. The faculty who teach in this program are primarily UC Berkeley faculty. It is the exact same curriculum that we offer in the online or in the on-campus program. And in fact, a lot of on-campus students choose to take our classes or sub in some of our online classes because they like the format, it provides flexibility. So again, this is very much we are maintaining the UC Berkeley reputation. It's a high quality program. We're not outsourcing any aspect of this to, like a third party online learning company. It's really, this is a truly UC Berkeley initiative. We also talk about having a close-knit community. So something that we didn't address in detail in this presentation, but have in others, is that our program has 2 required summer visits. And that creates an awesome opportunity for our students to connect in person, you to meet your cohort members, to meet faculty in person, get that one-on-one time with faculty during lunches, things like that. We build in networking opportunities. We bring in alumni. It's really such an exciting way for our students to get to know each other. And not a lot of online programs offer that sort of opportunity. And also, our students tell us that because the way the curriculum is designed, we do require some group projects. We require discussion board contributions, things like that. So throughout the program, even when you're doing the online learning portions, you will have reasons to get to know your cohort members, to interact with them. Our faculty offer live office hours that you can go to. So there are a lot of ways that you can connect with us. You can meet with us via Zoom, meet with your academic advisor via Zoom. If you happen to live near campus, you can come meet with us in person or come spend time on campus. So we really do a lot of work to foster a sense of community amongst our online students. And lastly, a supportive learning environment. I touched on a lot of these things, mentioning office hours and the fact that you can meet with us. But one thing I like to share is every single student in our program has essentially 2 advisors. One is your academic advisor, and that is you'll be assigned an academic advisor based on which concentration you choose. And then you'll also have a program, or I'm sorry, a faculty advisor. So you'll also have a faculty advisor based on which concentration you're in. And those folks are there, they're dedicated support for you to map out your course plan, to ensure that you're graduating when you want to graduate, that you've met all of your program requirements. We really are here for you. Our program, all of our staff, our faculty, we are here to ensure that you are having a positive experience in our program. We really believe that your success in this program is our success as a program. We really incorporate your feedback, which is something else that I think is unique about us. Our students provide us survey feedback or ongoing feedback, and we really genuinely take that into account. We make changes every cycle to ensure that we're supporting students as best we possibly can. So those are just a few things that make us unique here at Berkeley. And that wraps up our formal presentation. We want to make some time now for Q&A. Oh, and thank you, Stephanie. We've got some contact information on the screen here. So, we'll have time for Q&A, but if there's anything we don't get to during Q&A, definitely contact us. Set up an appointment with Stephanie if you want to talk through a more specific situation, and come to our other events. We have a graduate writing workshop coming up in June, where we'll go over how to write your application essays. So stay in touch with us. We really would love that. All right, so should we pause the recording and we'll open things up for questions?